Good evening, viewers. Welcome to another edition of the Business Forum. Today, we'll be talking about HIV and AIDS within our community. I would like to take this opportunity to welcome our panelists and ask them to introduce themselves.
Good evening, viewers. My name is Siram Dao. I'm the UNAIDS Country Director in the Gambia.
Good evening, viewers. My name is Usman Badi, and I'm the Director of the National AIDS Secretariat, NAS.
Good evening, viewers. I'm Binti Sane, working with the Reproductive and Child Health Unit, coordinating the prevention of mother-to-child transmission of HIV infection program.
Good evening, viewers. My name is Halimatu Diabaji Sorobo. I am working with the National AIDS Control Program under the Ministry of Health and Social Welfare, and I am the ARC coordinator.
Thank you very much. I believe we all know the significance of HIV and AIDS, and particularly within the private sector. As we have a private sector-led initiative, which we will be discussing later. But to start with, I'd like to ask Sira.
I work for the joint UN program on HIV and AIDS, UNAIDS. And UNAIDS is the lead UN agency that leads the advocacy, convene partners, and also mobilize resources for the response. UNAIDS is a secretariat, and it consists of the co-sponsors. These are UN agencies, and also the World Bank for their collective response to the HIV and AIDS national response. We do advocacy, we do capacity development, policies, formulation and legislation, formulation and enforcement. We accompany government in these efforts. We provide the technical arm, the necessary resources to enable government to come up with their policies, to come up with their legislations, to do the requested advocacy based on global and regional and national commitments and targets. This is the work of the UNAIDS. With UNAIDS, we have joint programs of the UN system that has been developed, and this is where all the UN agencies' key activities, key roles are manifested. It's where, based on our comparative advantage, based on the UNAIDS Division of Labor. For example, UNAIDS leads the advocacy, the policy, and we have agencies like UNICEF looking at PMTCT, UNFPA looking issues around sexual and maternal health. We have UNDP looking at the legislation, human rights issues, and gender issues around the response. We work with all partners. We try to convene all partners, UN agencies, the national institutions, NGOs, civil society. This is what UNAIDS does, and I would like to dwell more on the Business Coalition Against HIV and AIDS. This was an initiative that was piloted and promoted by the UN system in the Gambia. The UN system provided the seed funding for this initiative. It's a global one, and we are glad that the Gambia has a business coalition against HIV/AIDS. This is where we feel that the private sector also have a role in the national response.
Thank you very much, Sira. I really wanted you to emphasize so that the private sector understand how we come in when it comes to HIV and AIDS.
Yeah. Like I said, it was the UN system that initiated this together with the Gambia Chamber of Commerce and the National AIDS Secretariat. It has been dormant for quite a while, for obvious reasons. HIV/AIDS was under the radar, and a lot of things were not happening. This is an opportunity to revive the Business Coalition Against HIV, as we are repositioning and strategizing the whole national response on HIV/AIDS. So we feel it's important that the private sector play their role. They have to demonstrate their commitment to their employees. They have to demonstrate their social responsibility in the fight against HIV and AIDS. So this is something that the private sector should take the lead and the ownership of this coalition and ensure that the role of the private sector is also accompany national efforts. We should not leave everything to government or development partners. The private sector has a role to play, and a very important role.
Sarah, when you say the private sector has a role and a very important role, but I also want to ask you, who should take care of the financing of the work of the Business Coalition, which is the private sector response to HIV and AIDS?
Like I said, this is a social responsibility of the private sector. In other countries, a Business Coalition is entirely funded by the private sector. This is what we want the private sector in the Gambia, to form initiatives of the Business Coalition, but also to contribute to the national response. In the other countries, you have private sector coming in to buy drugs, coming in to have workplace policies for their employees, coming in to partner with public institutions to provide the ARVs, to provide the provisions or the consumables to be able to do testing, treatment, and care. So the private sector really has a very important role that we want to see demonstrated in this country.
Thank you very much, Sarah. You mentioned that the Business Coalition was an initiative of the UN system and the National AIDS Secretariat and GCCI that put the whole thing together. I just want to now switch over and talk to Mr. Usman Baji, Director of NAS. What is the significance of NAS? I can tell you, you hardly hear about NAS or what it does. What is NAS in the first place? Thank you very much.
Thank you. Thank you very much for the opportunity to be part of this discussion. The National AIDS Secretariat was formed in early 2001 to be specific, by the government of the Gambia to coordinate the national response to HIV and AIDS. As you know, there are so many players contributing their quota in the national response to HIV and AIDS. And the need to have a coordinating authority was recognized since inception. You will recall that the region, or the continent, Africa, at one point declared the situation of HIV as an emergency in the country. And there was a commitment at the highest political level in the continent to make sure that mechanisms and structures are in place that will definitely ensure an effective response to HIV and AIDS. At a meeting that was held in Abuja by African heads of states and governments, agreed on what was called the Abuja Declaration on HIV and AIDS, TB and malaria. And one of the outcomes of that meeting is to ensure that such coordinating structures are in place and, of course, have it at the highest political office, which is why we are under the office of the President. Initially, the global response to HIV and AIDS was coordinated by the health sector. But experts went back to the drawing table to say, look, HIV is so devastating, so big, that we need to broaden its coordinating mechanisms. But that said, even though the secretariats were formed, or in some countries you call them the commissions, like the Ghana AIDS Commission. In the Gambia you call it the National AIDS Secretariat. In Senegal you call it CNLS in French. So it's not unique to Gambia. You go to any country, as far as I know in Africa, you have NAS and you have the Ministry of Health. So the architecture is such that the NAS serves as the umbrella coordinating, but the Ministry of Health and Social Welfare, in our case, continues to play the lead role in terms of coordinating the health sector component of the overall response.
Okay.
So you have the health sector response and you have the community part of it. So NAS, by an act of parliament, is mandated to coordinate the national response to HIV and AIDS on behalf of the National AIDS Council, which is the policy body headed by His Excellency the President of the Republic, President Barrow. But we serve as the operational arm. And what we do in partnership with the Ministry of Health and other stakeholders, national and international, is to coordinate the response to HIV and AIDS, like I said. We also resource mobilize, and also in collaboration with the Ministry of Health, ensure that the appropriate policies are in place, and also provide some capacity building over the years. You know, like you said, it's the response that was under the radar, but NAS was doing things sometimes discreetly, given the challenging legal environment. We have provided support through the Global Fund for the training of healthcare providers in millions of dollars. We've mobilized resources with the Global Fund to train nurses in all cadres. These are the state registered nurses, state enrolled nurses, and the community health nurses. We've also, under the Global Fund grant, provided support for the training of areas that were never available in our training institutions for a very long time, and that is, we call them the Health Technician Training Institute. These are pharmacists. We've never had training for pharmacy technicians and assistants in the Gambia until when NAS came in to provide such support. We also providing support for the training of physiotherapy. It was initiated by NAS in collaboration with the Ministry of Health and the University of the Gambia. We've also initiated training of radiographers and physiotherapy. So these core competencies were lacking within the health system, and through the support of the Global Fund, we were able to provide, and we still continue to provide training in those areas in consultation with the Ministry of Health, the Global Fund, the CCM, and other partners in country. So behind the scenes, we were doing a lot,
Okay.
yeah, but limited in some areas due to the challenging legal environment at the time.
I'm coming back to the director of NAS. I want to find out what is the prevalence rate for HIV and AIDS in this country, and what does it mean for us being a small country?
Well, thank you very much. The prevalence, the national prevalence for HIV, depending on your source. In 2013, a year after I joined the National AIDS Secretariat, for the first time, the country, through the Gambia Bureau of Statistics, conducted a population-based study on HIV and AIDS, and of course, including other parameters, health parameters. The findings of that study revealed that the national prevalence of HIV and AIDS was 1.9% of the general population. But prior to the conduct of the DHS, Demographic Health Survey, we have had some other surveys, some of which are proxies, but they are conventional in that they are not only unique to Gambia, they use it in other countries to gauge the HIV situation. and countries use them. The UNAIDS, if you go to the UNAIDS website, is the National Sentinel Surveillance that they use to report on country situations on HIV and AIDS. If you look at the sex workers, the HIV situation is far more than the general population, and of course, MSM, men who have sex with men. I mean, the Gambian population, the average Gambian may think it is not an issue in our society, but they are key drivers of the HIV situation. You also look at other key populations too. There are variations. For the sex workers is 15.8. I stand to be corrected, my colleagues. And 9.8 for MSM.
15.9.
15.9 and 9.8 for MSM. So that, and again, there is currently another study looking at the situation of HIV in those cohorts, that is the sex workers, and the preliminary results again indicate an upsurge among the sex workers and among the MSM, significant rise, which makes it the more important for a renewed effort in the response to HIV and AIDS, like we put it, the need for the response to be repositioned in the context of national development, because experts are no longer looking at HIV as a health problem, they're looking at it as a development problem, which is why in the Millennium Development Goals, we had a specific goal on HIV and AIDS, and the SDG, although not specifically standalone, but HIV, look at some of the targets, they are very much linked to the HIV and AIDS response.
Thank you very much. And that takes me to the reproductive health program. I mean, it's all interrelated, and that's where life begins, mother and child. So I want to invite Vicky Sane to please tell us the role of her unit in the response.
Thank you very much, Edna.
Beatrice.
The Reproductive and Child Health is a unit under the Ministry of Health, and the program I coordinate, that is the prevention of mother-to-child transmission of HIV infection, is under the National AIDS Secretariat, National AIDS Control Program, but housed at the RCH unit, because the mother and the child is an RCH issue, and that's why the personnel is housed at the RCH unit. So the prevention of mother-to-child transmission is an umbrella of the HIV/AIDS program in the Gambia, because the HIV and AIDS program is just like an umbrella or a tree with branches. So one of the branches is the HIV counseling and testing. You have the prevention of mother-to-child transmission of HIV infection, the one I'm coming to talk about now. You have the other areas that the ACT coordinator would talk about. The overall goal of the HIV for the National Strategic Plan under the National Response is to the prevention and control of the spread of HIV and other sexual transmitted infections, like the STIs, sexually transmitted infections. Now you have the how do you call it again, this new program that is hepatitis, which is really a problem in the Gambia, but the ACT coordinator under the NACP would touch on that. And for the prevention of the mother-to-child transmission program, the objective is to reduce the transmission rate up to less than 5%. How do we do that? That is why I'm there. We have protocols that are documents that would guide us in the service delivery, because the service is not at one place, it's in all the regions in the Gambia. So in order to have a standardized service in the various regions where the coordinators or the program level is not, you need to have a standardized document that would guide all the service delivery. And we have had the nurse director said they have supported training of all cadres of nurses in the Gambia. Yes, that is in general nursing. But after that training, they need another training in order to deliver service for the prevention of mother-to-child transmission of the HIV infection, because it's a specialty area. And if they are trained in that, that also, as I said, is a standardized training document or package we have. And we have trainers who conduct training. And all those who are training have passed through a TOT, that is training of trainers course by experts outside the Gambia who are involved in the prevention of mother-to-child transmission services deliveries in other parts of the Africa or the world. And after that, we introduced the service to the facility, to a specific facility, and the services are then started. But how do they run the service? I want to see that for all the HIV services in the Gambia, they are confidential, they are free of charge, and they are private. You don't talk about it any way you want. We said yes, HIV, but in our documents we are talking of confidentiality. And confidentiality and secrecy are two different things, which we normally use interchangeably. Secret is, if you tell me this, Edna, your problem, or I realize that you have this, I should not inform anyone in this world. I should bury it somewhere. But for confidentiality, me as a pregnant mother, when I come to a facility, I undergo the service. Yes, I'm the one who is counseling you, but there is someone who will give you other services. I can, link you to those ones or refer you to those ones. I just want us to understand the difference between the secrecy and the confidentiality, because we say the words interchangeably, but in the HIV context we use confidential. And in the service, we have been testing mothers since 2004. We have been testing in the Gambia for PMTCT since 2004, which was the pilot phase. And during that time, it was the World Bank, and we call it the ARI, Accelerated Results Implementation of HIV. That took us 90 days. It was from there we expanded the program to other facilities. As I'm talking of now, we have about 57 sites who are offering the prevention of mother-to-child transmission of HIV infection. Now, when we talk about the PMTCT, automatically it is inclusive, the EMTCT that we are offering, talking of now, that is the elimination of mother-to-child transmission. We don't want to prevent only, we want to eliminate it completely in the Gambia. And I think we are in the right track. And I would again thank you very much for involving us in this business coalition, which we have been crying for long, because we have been in the regional AIDS committees, and we have some other people there as our chair or member of the committee, who are of business families or business communities. We always tell them, how do we get into the business communities? And today, I'm here by the grace of Allah. I thank Allah for that. And I just want to talk about how we can relate with you people when it comes to the PMTCT and the EMTCT program in the Gambia. Because we are women, we are the ones who get married, we become pregnant, we go through childbirth, we breastfeed, and we face most of the challenges in the community. Yes, we have other nationalities in the Gambia. We have seen the difference, how the men assist or help the women. But for you and I, our traditional men, it is different. All the burden is the woman. So, as the business coalition, I know most of the members there are women for that matter. We need to know about the program. We definitely need to know what PMTCT is and what EMTCT is, if we definitely want to help in that. So, how would we do that? Is by sensitization. This is one of the things we are doing. We are saying it is in 57 sites. The time we were starting, we had 72 reproductive and child health clinics. But as I talk of now, we have so many additional RCH clinics, which has, added to the 72. If not, I would have said we had only about 13 sites for us to, have the program in all the facilities in the Gambia. But it's better late than never. We have known that some of our challenges why we cannot scale up to those areas is training of personnel. As I said, you have a trained nurse, whether community health nurse, state enrolled nurse, or state registered nurse, but they need additional training.
Thank you very much, Binky. I think the passion that you've talked about used to dilate on the subject really gives us hope in the Gambia. And the private sector is really ready to work with you through the business coalition so that the women entrepreneurs can also be able to well articulate what is it that they need to know about HIV and AIDS and how they can also take care of themselves. I would want to now invite Halimatu to also dilate on the role of her unit in the fight against HIV and AIDS.
Thank you. Thank you very much, Beatrice. National AIDS Control Program is the arm of the Ministry of Health that was created as a result of the first AIDS case that was diagnosed in 1986. As a response, the Ministry of Health created a program unit and called it the National AIDS Control Program. And since then, it has been the coordinating body for the Ministry of Health when it comes to HIV, including sexually transmitted infections. And our program lines are about 5 or 6, namely, we do counseling and testing, like the PMTCT coordinator has said, because HIV counseling and testing is the entry point to HIV care. And the other component is the National Sentinel Surveillance that the Director of NAS said, to look at the trends of HIV over the years. And we have been doing it on an annual basis since the late 90s. The other component is sexually transmissible infections, looking at their prevention and control, including the treatment, and which includes a key component that the PMTCT coordinator mentioned during her introduction, that is hepatitis, and to be specific, the viral hepatitis, which is also another gateway to HIV care. Viral hepatitis has been underestimated in the entire globe, and public health have now turned to it. They are saying that it is one of the neglected diseases, and it's actually even doing more harm than HIV. Currently, the NACP is pioneering it and has also started. We have already developed a strategy and a policy And the prevalence studies that have been conducted through our partnership engagement with MRC is showing that the prevalence preliminary is at 10%, which is higher than the HIV. So it is a key component, and we hope that will also work, and it is one of the sexually transmitted infection. And the other key component program that we are doing is the HIV treatment itself, which I am coordinating. I am the antiretroviral drug or therapy coordinator nationally. And that is to say, if we test you and you are HIV positive, you should be on treatment. And that treatment, like the PMTCT could alluded, the service in this country so far through donors is free, and it's available. Currently we are in 14 sites when it comes to HIV treatment itself as a tertiary treatment. But when it comes to also, like you said, under the PMTCT, we are already alluded to that we are in 57 sites. And they also confirmed that they are also using the same ARVs for treatment. So that is the other program, and then the other program is actually looking at the component of coordination in terms of policy making and strategy making, and we work with partners, both government, private, and the UN system, to review policies related to HIV and STI, strategies related to them. And coming specifically to the HIV treatment program, everything started in the country in the same 2004, where it was being piloted, starting from 3 sites, and currently we are in 14 sites throughout the country, and it includes both the public and the private hospitals and facilities. The idea is, if you are looking at the prevalence that the director of NAS has said, alluded, 1.4% of the population, or 1.9 looking at the demographic health survey. If you look at the actual numbers, we are about 21,000 people living with the HIV virus. But if you look at those among the 21 who know their status, it's actually very low, because people, due to stigma and discrimination, are not willing to come out to know their status. And even at the health facility level, that we are saying that healthcare workers need to initiate counseling and testing by talking to them, sensitizing them, even that one because of capacity issues, resources, in terms of the health personnel, in terms of the test kits that are needed, it's also on the low side. So looking at our national response in actual numbers and projections, if we are looking at 21,000, if we only have 6,000 that are on HIV treatment, which is actually on the low side.
Thank you very much, Halimatu. Edna has just joined us, so I'll ask her to introduce herself and tell us a little bit about the Business Coalition Against HIV and AIDS.
Good evening, viewers. My name is Edna Sampson. I'm the Secretary General of the Business Coalition Against HIV and AIDS, in short, BUCAHA. What we do at the coalition is to lead and support the private sector, primarily in the Gambia, in response against HIV and AIDS. We do all of those through awareness, prevention and care, and also support the people living with HIV and AIDS in the Gambia. We support them through training, capacity building, organizing workshops in their offices, provide workplace policies, and also the distribution of condoms to everybody in the Gambia, both young and old.
Thank you very much, Edna. I want to come back to the NAS director before we now close. I know the GCCI Trade Fair is coming, and it's been tradition that the private sector would have stalls there. So can you kindly elaborate what would be happening during this upcoming trade fair next month, March to April 15?
Thank you, Madam. As a co-official member of the BUCAHA board, we have plans to also showcase HIV services during the forthcoming trade fair at the Independence Stadium, slated for 24th of March to the 15th of April. It is not the first of its kind. Over the years, we have partnered with the Chamber to showcase HIV services during occasions like the trade fair. This year too, we'll be having 2 stalls.
Yes.
to provide services on testing, HIV testing and counseling, but also to share very relevant information on other components of the HIV program and related commodities that we think are very important for the public to know. So we'll be there for the period of the trade fair. We're trying to partner with some other key players in the private sector, but also with the Ministry of Health and Social Welfare, being the experts on the health sector component of the national response for HIV and AIDS. So in short, for the period of the trade fair, Bukaha, in partnership with NAS and the Ministry of Health, ActionAid International, the Gambia, and other stakeholders nationally, would again showcase HIV services in the form of testing and counseling, but also related to other components of the national HIV response. Thank you.
Thank you. If you are just joining us, Bukaha means Business Coalition Against HIV and AIDS. Last words from everybody. Halimatu talked about stigma and discrimination, and I thought, or many people think, that's a thing of the past. So can we hear from all of my panelists where we are with stigma and discrimination?
Stigma and discrimination related to HIV and AIDS is still a major bottleneck in the response to HIV and AIDS, and this is not specific to Gambia, it's everywhere. There is ample evidence to show that stigma exists at the household level. Stigma against those living with HIV and AIDS exists at the workplace. Stigma against those living with the HIV and AIDS exists at the community level. And sadly, there is still ample evidence showing that stigma exists at the very places that are supposed to provide services and that's the health facilities. That's the reality. It's not specific to Gambia, but it's in other places. But when we say stigma, it is not always society pointing a finger at the person living with HIV and AIDS. That is what we call self-stigma as well. To a point that if you go to a health facility, you find someone you know, you don't have evidence that that person is going to disclose your status, but that alone drives you away. So you self-stigmatize yourself. Which is why even at the health facility, it may be the health service provider stigmatized, but it may be the individual himself or herself stigmatizing. So it's a very complex issue. And most of the time when we talk about it, people think they tend to focus on the society alone, but the individual also stigmatizes himself or herself to some extent.
That's a lesson learned today. Over to you.
Thank you, Edna. We have heard all that have been said, but yet still there is hope. Hope for being treated and hope for you being in good health and going back to your normal activities. As the nurse director said, he has said all about stigma and discrimination. It's not only the Gambia, it's not only the health facility. This is an international issue, and we are still working towards how we can minimize or fight against stigma and discrimination. But as he said, not only the health sector, not only those involved in HIV and AIDS, but the whole community at large, including the business coalition. And one thing I want to add before handing over to Madam Jisirobo, business was doing with job board before, that is the private sector. But now you people are saying you want to partner with the public sector. And I think people should start thinking that when you go to these stores, from this 24th of March, you will see both the public and private sector there. And I want to assure you that we don't just need to stop at HIV counseling and testing. I'm at the RCH. I want to promote family planning as well, and all that RCH is doing. So if possible, we might see family planning commodities there, not only condom.
Yeah.
We always take condoms, but there are more things there, commodities there than condoms. If it is displayed there, even if it is not given there, but people can see it, that is a form of selling, and that they can go to any nearby facility, or maybe the subsequent days we can bring it there, can issue it to people who can get it. Thank you very much.
Thank you very much. That's encouraging.
Okay. I think just to contribute to the stigma, stigma is a real issue, but I think the main cause, if we may want to look at it, is based on ignorance. And also another reason that our prevalence is low. Many of us do not know our status. So the best way to fight stigma, I would say, is let us all go and know our HIV status. So once again, we are saying thank you for the Business Coalition for inviting us. And like I said, we are always ready to partner with you, because I think all what you're doing is helping us anyway, the government. So we're saying thank you and good luck.
Thank you. This is already telling me that the partnership will be very fruitful, because you have definitely added value to what we had set out to do. Last words, Edna, what would you like to tell the business community about Pukaha? Do they all know about Pukaha? Or?
I would like to take this opportunity to talk to the private sector, especially those doing business, to come and join the Business Coalition Against HIV and AIDS for prevention and care. Also, for them to have counseling and testing in their offices. We do that together with Jabot Lab on Karaba Avenue, and it's free. You can contact us. We can either come collect one of your staffs, or anybody that wants to do the cancer testing, take him or her to Jabot Lab, and then the results will be provided, and it will be in secret. No one will know. Also, I'm calling on the general public to turn out, not only the private sector, but the general public to come to the trade fair to have their counseling and testing. Jabot Lab is going to be there. They will be providing the general public with the services. Calling on all of you to come and know your status. I know the thing in the Gambia, what is disturbing us here is fear of knowing your status. But let's come and be sure. If you are tested positive, you have care. If you are negative, you'll know how to stay negative. Thank you.
Thank you, Edna. And the coalition is leading by example. Immediately we set up the stalls. All the members of the coalition, particularly the executive, we are the first to go for testing.
Wow.
Thank you very much. This is one of the few panels where we have more women. But we're grateful to have the NAS director, Mr. Usman Baji, with us. Thank you very much to my panelists, and thank you for the enriching deliberation that we have. I believe in one session is not enough to cover the whole discussion. So we'll be inviting you again to other panels for us to continue this discussion. But thank you very much, and good night.